Today we will discuss about role of platelet in the in vivo sialations towards this anti-inflammation response. In the previous video we have discussed about the selective sialations that occurs, about the site-specific sialations of this B4ST6FC that will cause reductions in the inflammations. So in this case, based on some previous literatures, researchers have found out that the platelet activation helps in the in vivo silations. So they need to check whether this is the case with their custom designed antibodies that has the glycosyltransferase, or this is not the case in this role of platelets. The platelets does not have any role in their custom designs glycosyltransferase on antibodies. So first they check this NTN induced mice has some platelets or not, and they are able to see that the platelets presence in the NTN induced mice. NTN is the disease, or is the autoimmune disease. This mice has the platelets presence, and this star asterisk mark shows the CD41 positive cells. And in the panel B also they have shown that the CD41 markers and CD62 markers are almost absent in the case of this untreated mice, or mice that does not have NTN, that is not induced with NTN. However, when the mice induced with NTN, they can see that markers for this CD41, that is platelets markers, and the activations markers of the platelets, that is CD62P, that is also visible. So this indicates that the activated platelets are present at the site of inflammations, and the inductions or injections with this treatment with this IVIG and B4ST6FC on this NTN induced mice does not affect this markers presence that can still be seen in the IVIG treated NTN induced mice and B4ST6FC treated NTN induced mice. You can see the signals for CD41 and also this CD62P in both the cases, indicates that this IVIG and B4ST6FC does not affect the activated platelets. And thereafter, once they validated that activated platelets are present in the site of inflammations, they need to check whether it has a role in those anti-inflammation response or not. So what they did is they use the mice and treat them with this clopidogrel gel, which is the suppress the activated platelets. So what they have found out is that in the case of control, that is in the case of PBS, they are able to see that the bun levels at after 7 days are higher, and it can also cause the damage in the kidney, that can be seen in this percent survival rate, where in the case of PBS we can see that there is a reduction in the survival rate, and this control case does not have clopidogrel gel. And in the case of this panel C, we can see the clinical score which reflects the immune response. So immune response in the control case, where the clopidogrel gel is not induced, we can see that in the case of PBS the clinical scores are higher, indicates that the inflammations are higher, whereas in the case of IVIG and B4ST6 the clinical scores are lower, indicates that there is anti-inflammations that leads to the reduction in the inflammations in these mice, NTN induced mice. However, when this clopidogrel gel is introduced, the one different thing that they observe is that the clinical score for this B4ST6FC increases and is comparable to the PBS control case, whereas for the IVIG the clinical scores remains low, indicates that for IVIG it does not require the platelets for the in vivo silations or anti-inflammations, whereas for B4ST6FC it requires platelets for the in vivo silations or anti-inflammation response. And these things are quantified in this panel E, where we can see that for the control case The clinical scores are lower for both the IVIG and B4ST6FC. However, for the case where clopidogrel is used, the clinical scores are higher for the control and the B4S6FC, ST6FC, whereas they are lower for the IVIG treatment. And these things are reflected in the panel F also, where we can see that 1 levels are lower for clopidogrel treated mice that is treated with this IVIG, whereas it is higher for the clopidogrel treated mice that is diagnosed with this B4S6FC. And these things are finally reflected in the percent survival also, where we can see that percent survivals are lower for the PBS, for lowest for this B4ST6FC and the PBS, whereas they are higher for the mice that is treated with IVIG in the clopidogrel treated mice, where the platelets are deactivated. So from these results, the researchers are able to find out that it is the B4ST6 requires activated platelets for in vivo sialations or reduce inflammations, whereas IVIG does not require platelets for the inhibitory anti-inflammation response. So I hope you understood some basic idea about this role of platelets in this in vivo sialations or towards their custom designed antibodies that has engineered sialyltransferase. If you need to understand more about this topic or these experimental results in detail, you can go through the reference that has been provided in the description. That's all for this video. Thank you for your time.